All right, Dr. Don Bonner with Personalized Wellness. Today, you can tell we've got a scene shift. We're actually in our IV treatment room here at Personalized Wellness, and I wanted to do a little talk on just an initial kind of talk on IV therapy, kind of the do's and don'ts, what to look for, and again, we're here in Personalized Wellness. Please click that subscribe button down at the bottom of the page. Also click the little bell. That'll give you an alert when I put out a new video. Subscriptions help us here at our channel and will help us continue to bring this content to you. Okay, so you're thinking about getting IV therapy and you don't really know where to go. You see advertisements out there and they all look pretty much the same, right? Well, they're not all the same. You want to find out before you have your IV therapy done. You want to know, first of all, who's performing these IVs? What credentials do they have? How long have they been doing this kind of therapy? And do they know what they're doing? So you want to make sure that, again, that they have the knowledge to do these things. Personally, I do the IVs myself here at the clinic. I manage the IVs, I make the IVs. And again, making them is very important also. And as you can see, this is our laminar flow hood that we use here at the clinic to sterilely mix up these solutions. You want to make sure that all of those things are being done before you get your IV. So again, you want to know the training. You want these things prescribed specifically for you. You don't want to go into some place that has a menu of different IVs and you pick out, basically what you want. It's a huge red flag, and I would never advise anybody to go into that sort of environment. So, what we do at the bare minimum is we get a CBC, we get a CMP on everybody that we're going to do IVs on. And I also go ahead and get a glucose 6 phosphate dehydrogenase, G6PD level, just to make sure that they're not deficient or you're not deficient in this particular enzyme. If you are, and we use moderate to even to high dose vitamin C, you can have what's called hemolysis, which can be very dangerous. So basically that's what I get as far as lab work. I want to make sure your kidney function's good. I want to talk to you before we prescribe any medications and IVs to make sure your heart function is good. And again, that you're not having any renal issues because, we don't want to cause any problems here in the clinic. Is the person able to handle any complications? If there's an allergic reaction, if the person has pulmonary edema, are you able to handle those things? Here at the clinic, we have monitoring, we have oxygen, I can give positive pressure ventilation, I can even intubate somebody if I had to. Here in the clinic, we can resuscitate, the person if something bad happens. So we're prepared to handle any of these sorts of problems that come up. And as a board certified anesthesiologist, I feel like I can handle, obviously, these sorts of problems. So you want to know those things. Very rare that anything bad like that could happen with any of these IVs, but again, you want to be prepared for any of those kinds of problems. So again, we talk to the patient, we get a consult, we get some lab work to make sure everything is functioning appropriately. We prescribe specific types of formulas depending on the patient's needs, and then I'm here to manage and mix up these particular infusions. We'll go into different IVs in the upcoming videos. We do everything here at the clinic from, I do IV ketamine for depression. I do different formulas of IV vitamins and minerals. Some of those are basically just rehydration formulas to basically build you up for, say, a pre-endurance event or post-endurance event, pre-surgery, post-surgery. All of those things would be very beneficial to have these kinds of fluids either before or after. I also do more oxidative procedures like high dose vitamin C. Those are going to be used more for patients that are fighting off viruses or Epstein-Barr, Lyme, any of those kinds of problems that somebody would have. We would use higher dose of vitamin C, all the way up to 50,000 milligrams or more of vitamin C. And again, so that's very specialized, and you want to make sure that that all of those things are done correctly. So that's kind of my take on IV therapy. Make sure you know who's providing the service. Make sure that they're taking proper precautions and that they can handle any complications that potentially could arise. So again, click that subscribe button, click the bell down below. It's Dr. Don Bonner at Personalized Wellness. Give us a call here at the clinic, 601-898-0911. Book an appointment, and we'll get you set up, and if it's appropriate, we'll definitely give you an IV. Thank you.